Hello everyone, welcome to today's presentation on radiology in Trichomonas Vaginalis infection. When we hear about trichomoniasis, we usually think of laboratory diagnosis, but many students ask, does radiology have any role in this disease? The answer is yes, but only in selected cases. Throughout this lecture, we will understand why imaging is not used to diagnose the parasite itself, but become very important when complications develop. We will also discuss the role of ultrasound, CT and MRI in both female and male patients. Trichomoniasis is one of the most common non-viral sexually transmitted infections. It is caused by protozoan parasite and Trichomonas Vaginalis. In female, the infection mainly involves the vagina, cervix, urethra, and sometimes the urinary bladder. Symptoms may include vaginal discharge, itching, and painful urination. In male, the infection commonly affects the urethra and prostate. Most infected men are asymptomatic, but some may develop urethral discharge or burning during urination. One important fact is that nearly 70% of infected individuals have no symptoms. Diagnosis is mainly clinical and laboratory based. Radiology has only a supportive role in detecting complications. Diagnosis is mainly clinical and laboratory based. Radiology has only supportive role in detecting complications. Before discussing imaging, it is important to understand that trichomoniasis is diagnosed in the laboratory. The gold standard test is the nucleic acid amplification test. Now the question is, why perform imaging if laboratory tests diagnose the infection? The answer is simple. Imaging is used to assess complications, evaluate severe symptoms, and exclude other diseases. Patient with severe pelvic pain, fever, suspected pelvic inflammatory disease, scrotal pain, or atypical clinical finding may require ultrasound or other imaging studies. So remember, radiology is a problem solving tool, not a diagnostic tool for parasite. Wet mount microscopy is quick and inexpensive but has lower sensitivity. Culture is another option, although it takes several days.